Good evening, everyone. Thank you for joining us for tonight's Menopause Chat. I am joined today by Jan Howells, a physical therapist at WellSpan. And tonight we are talking about a very exciting topic of bone health. And a lot of people might not think that this is an exciting topic, but I think we're going to change their minds by the end of tonight's webinar.
I hope so.
For those of you that are attending for the first time, I'm Dr. Melanie Ochalski. I'm a reproductive endocrinologist and certified menopause practitioner. I see patients at WellSpan's Midlife Health and Wellness Center, and that's where we are now at Apple Hill. Jan, first tell us a little bit about your background and why bone health is very important to you.
Okay. Well, I'm Jan Howells. I am a physical therapist. I work right behind us in the next building over at the WellSpan Surgery and Rehab Hospital. I currently do not see that many patients right now because I'm a manager of the post-surgical and outpatient clinics. Keeps me on my toes. And quite honestly, years ago, I didn't have any interest in this class, but I needed to take some CEUs and some continuing education to keep my license. So why not? I'm going to sign up. Right away, hooked. This population is underserved and we don't have a good understanding. And you might be surprised, but you can't come to physical therapy just because you have osteoporosis. It's not a diagnosis that insurance companies will reimburse for physical therapy treatment. So if you have something else in conjunction with it, back pain, or you've had a fracture, then we can kind of look at it together. But if you just want to come to me because you've been diagnosed with osteoporosis, you're not going to have much luck there.
Yeah, it's interesting.
Yeah.
I think until you have a family member or friend who has suffered a fracture from osteoporosis and you see how life-changing it is, you don't really appreciate how important this disease is. Mm-hmm. And like so many midlife issues, it's preventable and treatable. And so tonight we're going to give you some really good tips about how to identify what risk factors there might be, and know what steps you can take to prevent further bone loss. I just want to start by saying that women have the most rapid bone loss right around the time that they're getting their last period. So when they are newly menopausal is when our bone density starts to decline pretty quickly. I think it might be best just to start by having you explain what osteoporosis is, why is bone strength important?
Absolutely.
So I want to share. Did I do that right? Okay. Does that look good, Sue?
Perfect.
Okay.
Yep, go to the next slide. Okay, so everybody is wondering, what is osteoporosis? So it means porous bones. So we think of bones as being very dense, like a solid structure. But in reality, they're not. They're very porous. There's space or air within the bone. And it also has an elastic property to help absorb forces throughout the day. So
like a sponge almost?
Yeah, or like a honeycomb. And we can show you a picture of that in a moment. But when bone loss occurs, so basically we're always creating bone and absorbing bone. But when that balance is off and we tend to start absorbing more bone than we're creating, our bones tend to get a little bit weaker. We start to have little fractures in there. We don't have as many minerals that we need. We need our calcium or vitamin D to help create those bridges within the bone. So when there's that balance is off and we start to see these fractures, that's when we have osteoporosis. So if you're looking at this screen right now, you're probably thinking, what the heck is this? But
It looks bad.
Can you see where the fracture is? It's kind of tricky. So remember I said this is a microscopic view of inside the bone, and you can see it's very airy, but right here, it's missing a bridge. So this is actually a fracture within that bone, a little tiny fracture. So when you have a whole bunch of them accumulating, that's when we're in trouble.
Wow.
Yeah. So this would be a normal on the left side, a normal bone. And you can see again, it's like honeycomb, like there's a lots of space within that. And that way, forces, this is actually one of the vertebral bones, the bones that are stacked within our spine. And then on the right, this is an osteoporotic bone, and there's a lot more space in there. And then you can look, there's little fractures within these structures. So you can see that this would probably break down a lot easier than that bone on the left.
And when someone goes for an X-ray or a bone density scan, this is what we're picking up, how the normal bone pictured is going to be denser and thicker than this fragile.
Yeah, and actually if it's picked up on an X-ray, it's bad. You're far advanced. I think it's like 20 to 30% of your bone, is osteoporotic. That's very risky. But the DEXA scans, they can pick this up quicker. You don't have to be so far along in that progression. So it's a good screening tool to use. But also osteoporosis is the silent disease. I don't know if you've ever heard that term.
No, I haven't.
So basically, a lot of times we don't feel that we have osteoporosis. We don't necessarily have pain because we have osteoporosis. Or if I go to the doctor and have a physical, they're not going to just visually look at me and say, oh, you have this condition. A lot of times we can experience a fracture, a vertebral fracture, like a compression fracture in our spine, and not even experience pain with it. I think only 20% of those fractures are painful. So you could be walking around with this without even knowing.
That's pretty scary.
It is scary.
So who's at risk for developing osteoporosis? What are some risk factors?
That's a good question. So if we'll go to the next slide. So female. Yep. 1 in 5 are going to experience this, whereas men, I've heard between 1 in 4 and 1 in 5. It depends on where you're looking for that information. Caucasian or Asian. Postmenopausal, which you've mentioned. Small bone, so you think of people with smaller frames. They're not carrying as much weight, so they don't have as much stress on their bones and their bodies, so they're at risk. Family history is huge. Delayed puberty, early menopause. Things that we control are smoking, that sedentary lifestyle. The more active you are, the more stress is going to be on your bone. If somebody has an injury and they're immobile or they're hospitalized and they're not moving around, their bone is going to be absorbed. The advanced age, so over 75 years old, men and women are at the same rate of having osteoporosis.
Oh, wow.
Yeah. Over exerciser, so the marathon runners and the triathletes that sometimes aren't getting the proper nutritional balance. You think that they're doing all this great exercise, which it is, but if you're not looking at the whole picture, then they can actually end up fracturing a bone.
And many of those extreme athletes are not always making as much hormones too.
True, yes.
So I bet that's a double whammy.
It is a double whammy, definitely. And then you think about like the gymnasts that tend to delay their, we already say delayed puberty, but leads to this. Yeah. And then also a female that has never had a child. And you might be able to speak to that area, like why. But,
right. So without estrogen is very helpful and protective for bone strength. And women are exposed to some of their highest estrogen levels for the most prolonged amount of time during a pregnancy. So that without having born a child and gone through a pregnancy, that can be one of the risk factors.
I think it's interesting also, it affects any age group. any sex, male and female, any nationality. It can hit on anybody, and it all really depends on, looking at lifestyle factors and your family history can all contribute to this. I feel like because when you're young, we're building up our bone density. And if we're getting the proper exercise and the proper, calcium intake, then we're setting ourselves up for the rest of our life. So like our bones are like the densest in our early 20s. And then it starts to go down from there.
Wow.
So we need to encourage our kids, our grandkids to, drink milk or eat cheese or, dark leafy greens. But also I'm fearful of the population that we're always using baby carriers, and these kids are always in like a C-shaped form. They're not on their bellies as much. They're not exploring the world. So they're not getting those forces on the bones when they're infants and at young ages that they need to help create good posture when you're older. So I have seen a lot of young patients that have really poor posture, and we'll talk about that in a little bit.
So why do we care about this, and like what are some of the most common fractures that you would see?
Yeah,
so in the clinic?
Like I said, we hear about fractures a lot, or find out that we have osteoporosis after we've had a fracture. So the vertebrae or the spine is where we're going to experience the most fractures. And that's because that bone is a little bit more porous or open than the other bones on the body. But it's also because you have your ribs that protect the spine there. So if the ribs kind of block the muscles from attaching directly onto the spine, so you don't have a direct pull muscle force on that bone. Same thing with the femur. So that the leg bone, the big leg bone that attaches at your hip, a lot of times we'll have a fracture right at the neck of the femur. It's like the part that curves the most, because there's no muscle that attaches directly onto that site. So there's no force or pull there to make it strong. Or when we fall, it's a tricky angle and it tends to kind of shear. So think about your bones like a callus. When you're wearing new shoes or you're training for a long run and you're getting that constant friction in your shoe, how does your body respond to stress or friction?
It like thickens that, strengthens that area.
Yeah, it builds up those cells. It makes them thicker and stronger, so that over time you're not going to feel that friction as much. It's like toughened it up. You might be able to walk barefoot in the summertime because you do it all the time, but at first it's like, oh, that's really painful. So that's how our bones respond. So they respond positively to stress. So the more stress they have, like a pull on the bone, which is like a muscle pull on the bone, or force, like when you're walking, you have that weight-bearing force or that pounding, that's what's going to help build that bone, make it stronger.
That is really cool.
Yeah. The other areas that we will see, the distal wrist or the when you fall, what do you do?
You're like,
you put out your hands to break that fall, and you get a fracture. And then the other thing I was gonna say, a lot of times when you have a fracture in your spine, if you receive a fracture, most likely like you'll end up having a cascade of fractures. Within the year, you'll have another fracture, and then you might have another fracture. Just one leads to the next, unless you're doing things to kind of correct what might be leading into that fracture. So we look at our posture and we're kind of slumping. We're always, think about our lifestyle, how we do so many things in front of us. Yeah, we're like, we're cooking, we're leaning over the stove, and we're constantly bending and picking things up. We don't spend that much time like lying on our stomach. We tend not to stand as tall as we could anymore, or even sit. We tend to kind of go into that C-shaped. But that constant trauma there, it's like that constant compression, it breaks down the front of that bone. And then that's what kind of leads to that. You see people that have the hump on the back. That's like the bone kind of condensing down. So that's actually a telltale sign that osteoporosis is occurring. If you go to the doctor, have your physical, and they get your height, and they're like, you lost an inch. if you hear that, you need to get a scan. You need to get that looked into, because that is a telltale sign that this is occurring.
So it's interesting that fractures beget more fractures.
Yes.
So you had a really interesting slide that kind of explains why osteoporosis is so harmful and so impactful for quality of life.
Oh, absolutely. I mean, it just affects so many different areas. So think about if you have back pain, what do we tend to do? We don't move as much because we're fearful that we might hurt our back even more. And then we might stand in a position because you might actually stay slumped forward because we're afraid every time I straighten up, I get a little bit of a ting, like a twinge or something. So that is leading into a further spinal deformity. So if you think about if you're leaning forward, what does that do to your lungs?
Narrowing them.
Yeah, narrowing down. It's like pressing them down. So now you can't get a really deep breath and that full lung capacity, which is going to limit your ability, to even go up and down the steps or just do things around the house. You're not getting all the oxygen that your body needs. Again, it's because you're slouching forward, it's going to impair your function. So think about if you're slouched over and you try to reach over your head, you can't reach as far as if you're sitting up nice and tall and I can reach a few, a good 4 more inches than I could. So then it starts limiting your vertical level. You're going to start bringing things down to you. It can lead to depression and appetite loss, sleep problems. If you have appetite loss, then you might not be getting the nutrients that you need to help build your bones. Again, decreased activity level. You're just not moving as much. And remember, your bones crave that stress. It needs muscle pulls and forces on them to get stronger. So without that activity, again, your bones are starting to get weaker. Again, increasing that likelihood that you might have another fracture, or you're not as mobile, not as strong. So you're starting to lose balance now, or you're not able to correct yourself when you are losing your balance to regain it. This leads to increased lung problems and other comorbidities. And then it just keeps spiraling and spiraling. So it's not a good place to be.
No, this is, it's scary. All right, so what can we do to prevent this?
Yay!
Because this is this is a good story, a happy ending story.
Right. So I think really this is called the triangle of management. There's 3 different areas that we can really hit on. You have the medical management or medication. We have diet on the bottom, and then we have exercise at top. And I put exercise at top because to me, that's the most important. I'm a physical therapist, so I'm going to emphasize that, and that's my strength or expertise. But really, this all boils down to you, what you're going to do. What is your impact? How are you going to control it? It's very easy to rely on medication or a pill.
I got to
get there. So this is my little comic, and it says, to treat your high blood pressure, diabetes, hyperlipidemia, osteoporosis, take this new pill every day. Take it for a jog, take it to the gym, take it on a bike ride. So it's the E-pill, it's the exercise pill. So I really, truly feel there's so many health conditions that we can affect by just moving.
Yeah.
Heart disease, we can just go on and on. But truly, for osteoporosis, it's it is the one thing that will get your bones stronger.
Yeah. And I think we're so conditioned to wanting a quick fix.
Yes.
And this really is a quick fix in that even small changes can have big differences.
Yes.
And have a big impact.
And some of the exercises, honestly, are so easy. To me, they're not even exercises. One of them is just lying flat on your back. You can't do that. Well, I take that back. There are people that can't do that. It's challenging. And that would be one of your goals, is to try to ultimately see if you can get into that position, work into that position. But it's, just lying on your back with your legs out straight and doing some deep breathing helps to really lengthen the spine. It elongates that. So it's something that we should all be doing.
All right. And I think you have some some information on different strategies and exercises. But to begin with, what are some tenets of osteoporosis prevention?
Right. So prevention, I think, is key, like between just preventing the disease and preventing a fall. So preventing the disease would go more into movement and the proper balance for nutrition. So like making sure that you get your vitamin D and your calcium. And there's really, if you can get it through a natural way of intaking it, through your diet, that's probably best. But then there's times of the year you're probably not getting the vitamin D that you need, especially now when they always say like we should all be wearing sunblock. And it is good to get out there and get a little sun without your sunblock so that you can absorb that vitamin D. But in the winter, I mean, I need to take it. Like I know my body doesn't absorb it. I've been told by my physician, they've looked at that. So it's, a supplement that I'm going to have to take. And then same thing with calcium. Like some people absorb it very well and others need a little bit of a boost. So that's something that you can work out with your doctor to see specifically what you need. And again, if we look at my expertise, which is exercise, so doing regular weight bearing exercise, walking is key. So not walking in a pool, but because the buoyancy of the water is going to take some of that force off. But getting outside and going for a walk, you can get your vitamin D at the same time. Get some fresh air.
Like tonight.
Yeah.
As soon as we're done.
Yeah. Let's all go out for a walk. There might be a question too. And then some strengthening, doing some strength training that we can talk about in a little bit too. Fall prevention, because again, if you have one fall, that can lead to the next fall. So especially for a hip fracture, it tends to lead to like using an assistive device long term. So it might be like a rolling walker or a cane. People don't like that. It's like losing their independence a little bit. It's trying to juggle carrying your groceries and pushing a walker or carrying your cane with you can be a little bit tricky at that point. And you can forget it. Like sometimes you're like, oh no, where did I put it? So you can, for fall prevention, we can do different types of things, balance exercises. Even with the walking, we like to confuse the bones. So if you do the same thing all the time, your bones get conditioned to that. But if I'm walking and I practice walking sideways, I do some sidestepping. Or walking backwards.
I love that.
Turning in circles or doing some figure eights. That way, when these things occur in life, we are more attuned to adapt to it in a quicker way. So if you think about when you're in your kitchen, you don't always walk straight on to everything. You probably take a couple little side steps to grab something off the counter, and then you're going back, take a couple steps back. So your body will respond to that quicker if you practice it. But if we always just walk in a straightforward line, your body will get accustomed to that, and it won't rely on those quick changes. It won't prevent you from having a fall. So that is one thing that we work on in therapy is like quick changes in direction. Even just when we're balancing, like pretend you're an ice cream cone, and it sounds funny, but pretend your feet are planted in the ground, which they probably are, and then with your shoulders, you're just going to do like a circle and kind of just go around in one direction and then practice going around in the other direction. So when you start that, your cone might be very narrow, but as you build strength and start to get better balance, you can make that cone a little bit wider.
I like that.
Yeah. And then we can also really focus on good posture and safe movement, which I'll talk about a little bit in a minute, and avoid tobacco use and alcohol intake.
Yeah, that for any participants who have been with us for previous lectures and webinars, that's consistent. Tobacco and alcohol.
Absolutely.
Like everything.
Yeah.
All of the risks that midlife women are predisposed to are just heightened when there's alcohol or tobacco on board.
Yep.
Someone has asked a great question. How much calcium should we be taking, and what's in a daily vitamin enough? What I tell my patients is, unless you are intentional about having a strong diet-based calcium intake, having 1,000 to 1,200 units of calcium a day is what's recommended. And your body's not great at absorbing more than about 500 at a time. So ideally in divided doses is what's recommended. And it depends, because some women's daily vitamins will have an adequate amount. It's not unusual though that you need to pick up an extra calcium and take that in addition to what's in your multivitamin. Is that consistent with what you tell patients?
Absolutely. And just learning how to read food labels. So if you look at the size, the serving size, you would be surprised that you might be getting more calcium than you actually think you're getting. So a lot of times, I know when I pour a glass of milk, I probably don't pour exactly a cup of milk. I probably pour more than a cup of milk. So if you look at the nutrition label, it'll tell you how many ounces, how many milligrams, but it also give you a percentage. So it might, if it says 20%, that means you just drank 20% or you just consumed 20% of that need for the day. So sometimes that is a little bit easier to think about than trying to add up, oh my gosh, how many milligrams did I have? Am I there yet? Yeah.
That's a good tip. And then if you have some cheese and that's 10%, then your goal is 100%.
Yeah.
I like that.
Yeah.
And in addition to dairy-based options, what are some other places we might be able to find calcium?
So I know there's a little bit in almonds. I don't know how much to be exact, but
great.
Leafy greens, but not necessarily spinach.
Okay.
So, I love spinach. I throw it in like everything, but it has to do with like the acidic content. I believe it competes with the absorption. But then you could do kale, which would have it. So there are lots of options, and I can give you some pointers at the end where to find that information on the internet.
Perfect.
But yeah, you can explore all those dietary needs.
Yes. And so as I'm looking at myself in the mirror, or not in the mirror, but in the screen, and
I'll give you a little quiz here.
Yeah. Let's talk about that posture, and
just minimize that there. Okay, so when you're looking at the screen, can you tell me which person or which figure you think has osteoporosis?
Well, definitely that last one.
That's what we think right here, right?
Mm-hmm.
So this is what we think happens to our posture as we age, but it's not necessarily happening because we age. So when we're born, and if we don't have any, if we're born and everything's anatomically correct, there's no abnormalities. That's what I'm trying to say. As you become an adult, you would expect us to look like this on the left-hand side.
Mm-hmm.
But like I said, there are some teenagers, I've seen even 12-year-olds that have more like this posture in the middle.
Mm-hmm.
They play a lot of video games. They carry extremely heavy backpacks. They have no awareness of what their posture is. So they can have that posture right in the middle. And then, we might expect to see us on the far right when we are having these spinal fractures. But some of this is really habitual.
Mm-hmm.
I've worked with 90-year-olds that look exactly like this gentleman all the way on the left-hand side. They're just very aware. Maybe they were a dancer when they were younger and they always like to lift themselves up, or think about attitude. So,
mm-hmm.
Some people that are a little bit more sure of themselves tend to hold themselves a little bit more erect, or people are shy or depressed, they tend to kind of slump down.
Mm-hmm.
So it's a lot of accumulation. So I think about somebody that works at the computer their whole entire life.
Mm-hmm.
They're going to have that more rounded posture too. So these are some of the things that we do have control over, and we want to, if you're in one of these areas progressing toward the right of the screen, we can reverse it. So I can't promise you if you're all the way here on the right that you're going to make it over here on the left, but you could probably get to one person over or to two just by some changes. So we can work on some strengthening, some stretching, and really just postural awareness, constant postural awareness.
So about that postural awareness.
Yeah.
So what can we do to help improve our posture?
Yeah, so I think about my posture a lot. And I probably didn't do this until I worked in a retirement community. And I just started really noticing different types of postures. And I'm like, I really don't want to look like that, or I don't want to experience that.
Yeah.
So I just kind of, and I'm short. So I just kind of started to think about, okay, what if I was 2 inches taller? Yep. So I'm just pretending I'm 2 inches taller. It kind of automatically elongates you. Or you can think about, you've probably think about the golden thread that's attached to the top of your head, pulling you up to the ceiling. That's lots of visualizations I feel like that help. You can also pretend that you're like holding an orange or a grapefruit between your chin and your chest, and you're trying to keep it balanced there. If you're a coffee drinker, so you're gonna like this one. Pretend there's a shelf right here on your sternal notch. So like this little notch right in the front here. What do coffee drinkers want? They want to keep their coffee on that shelf. So if I have my coffee cup here and I'm leaning forward, it's going to slide off.
Oh, I see.
Okay,
so
you want to
try
maintain
to keep it.
that. Yep. If you're a woman, you can also think, I have the Hope Diamond here, and I want to radiate that out to the world and be proud of my gem. And then for men, I say, like, pretend you have a bow tie and you're going to someplace fancy and you want to show that you're a man of power. So you're gonna, yeah. So all these little things, just thinking about throughout the day for standing, especially. You can practice them when you're standing in line at the grocery store, when you're standing in the mirror in the morning and you're brushing your teeth, or just any minute that you think about it is going to help improve your posture throughout the day. But really, I also really like to concentrate on sitting posture. I tend to sit on the very edge of my chair, and I can show you. We'll go to the next slide over here. Oh. All right, so it's not, I got us out of order here, but here we go. Okay, so when we're sitting in a chair not supported, you can see that you have like this C-shaped. Okay. So if you think about gravity pushing on your head and your shoulders, that's pushing you down to the ground. It's going to accentuate that C shape. And then you also have the chair pushing up against your buttock. So there's a lot of force right there on your spine. If I can find a way to sit so that my knees are lower than my hips, it's automatically going to start to kind of raise me up a little bit and get me out of that C shape. But it also puts some of the force through your legs. So now you don't have 100% of the force working through your spine. So if I'm sitting, I'm going to sit on the edge of this chair here and kind of show you. You can try it if you want. But when I sit here, and as soon as I put pressure through my legs.
And I just want everyone to be able to see you do this.
So as soon as I put pressure through my legs, it kind of raises me up, makes me sit tall. And it's actually, for me, it's harder to sit slouched like this versus perched sitting. It just feels a little bit more natural. So that's that middle diagram there. If I'm sitting in that fashion, my spine looks like almost the same as when I'm standing. So everything is balanced. I'm not hanging on my ligaments. I'm not putting a lot of pressure on my discs or pressure on the vertebrae, especially the front part where it tend to have some of that force. So it's, just a matter of like leaning up against something, sitting on a high stool with your feet on the ground. That will take some of that force away from your spine.
And I imagine that some of the standing desks are even
beautiful. They're awesome. Yeah. And as long as you're thinking about, even when you're standing, keeping your shoulders up and not just rounding forward. Because I know for me, I tend to start to move toward my screen throughout the day. I'm like a moth to the light. But if I think about okay, I just where is my head in relationship to my shoulders? If I think about the hole in my ear should line up where my shoulder is, that sometimes will help kind of bring me back.
Oh, wow.
So if I'm forward like this, and then there's going to be a lot more strain on my neck.
Which is why people probably get headaches and have other issues.
Yeah.
right.
So the next one,
Maybe I'll let you.
drive a little bit here. So I think this is really interesting because it shows positions, how they impact stress on our spine. So if we look at the bottom left of the screen, little tiny person there, lying down on his back. And actually I've seen one that is at 0. That's if you lie on your belly. There's like 0 stress there. 0 force on your spine. And then when on your back, it's at 25. And I'm sorry, I don't know what kilograms. So it's very low stress on your spine. And that's one of the reasons why it's a great exercise to lie flat. And then the second picture is side lying and then standing. So you can see it significantly increases, but still low forces. Then the next set of pictures, you have somebody sitting in a supported chair. So their feet are on the ground and their back is against the back of the chair. There are increased forces there, but it's still in a relatively healthy position. Standing and leaning forward. This is when we start to get into trouble. We're starting to increase those forces on the spine, on the discs, on the vertebrae. So if you're sitting and leaning forward, look at how much it jumps from just standing and leaning forward. So sitting is worse. And you think about people in a skilled nursing facility,
they're all day.
They might be in a wheelchair, or they might be sitting on a sofa. That sedentary lifestyle, that's a lot of stress on your back. Standing, you gotta stand. And then the next picture is somebody standing and lifting up a weight. But look at the top picture. It's sitting and lifting up a weight. So this is a lot of like the office workers. I think about when they reach down into their desk and pick up some like heavy files or pick up a heavy book off the floor. They're putting a lot of strain on their back. And it's that accumulation. So I hear a lot of people say, I picked up a sock and I blew out my disc, or I experienced increased pain in my back and I wasn't even doing anything. Well, it's like the accumulation of doing these things. And it's usually like that small movement that all of a sudden will make a big impact on your life.
Wow.
Yeah.
This is a really helpful slide here.
Yeah. Okay. So let's go so I'm going to show the next slide that's going to show why lying on your back is so good for you. So it's kind of hard to see. So I have my little ruler here. Hold on. It's on my desk. This is actually a sewing ruler. It's flexible. I don't know if you can see this in the video here. So I like to use, because if it's like your spine, I can bend it a little bit. So our spine is like a little bit of a S shape. I'm not going to accentuate too much. So when you're standing or sitting and you have gravity pushing on you and your chair pushing up, you can see how, and this is like totally exaggerated, but how you're going to shrink.
Yeah.
Right? But if you're lying down and now you have the force of gravity and the the bed or the floor against you, how that lengthens your spine.
Right.
So that you're doing something healthy for your spine without even realizing it. You're decompressing or elongating it. So that's your first exercise right there.
Okay, I can do that. Just laying down on the floor.
Do some deep breathing. Try to think about relaxing things. But this can be very challenging for some people. So sometimes just starting this in a recliner might be a good position to start in. And then working yourself down to maybe the bed with some supported pillows. Like we might have that forward head posture and I can't bring my head back without pain or really tilting my head. So I can put some pillows there and gradually work down to trying to get my head flatter. Sometimes you might need to put some pillows under the knees, but again, you want to gradually decrease that. So maybe you have 3 pillows and then you work to 2 pillows and then to 1. I wouldn't do it all at one time. It might not feel so good, but over time you can get there.
Well, that last slide that you showed, it makes me think about the way you sleep.
Yeah.
Whether you're a side sleeper or not, or you're on your back or on your belly.
Yeah. So I know like a lot of physicians say don't sleep on your belly because you do have to really turn your head to try to breathe, right? Unless you have a hole in your bed and You put your head in the hole. So yeah, if you are a back sleeper, which I feel like a lot of people aren't necessarily, it tends to make people snore. That is, like I said, good for your spine. But if you sleep with a lot of pillows under your legs, then you're going to end up getting some tight structures in your hip. Like your hips are going to be used to being in that bent position all night long. So then when you go to stand, it might make it really hard for you to kind of stretch out more. But usually, like people that are healthy tend to move a lot when they sleep because your body will naturally adjust when it's feeling a little bit uncomfortable. But when we have other health conditions competing, we tend not to move around as much. You might not be able to breathe as much if you're changing into a position, or if I have a history of a shoulder problem, I can't sleep on my right shoulder.
Right.
Yeah.
Interesting. How like one little change can either, be a force for good or cause more issues.
Yep. So we're going to go to the next. So we talked a little bit about the decompression. So that's what we talked about, this top part here. And maybe just starting at 5 minutes or 3 minutes, whatever you can tolerate comfortably. And you can build up to 30 minutes if you want. I'm very antsy, so I tend not to stay in positions for a very long time, but I'll do like a variety of things. So the next one, the bottom left, it's called a head press. So again, as we age, our head tends to come forward, or we get that little bit of a hump, and then we tend to get headaches because there's a curve in our neck there, and it's tighter there, that we're crunching down on that space. So this is to help reverse that. So when you're on your back, you're going to press your head straight into the pillow or into the floor, onto the surface, without trying to like tilt your head, like your chin up to the ceiling or tucking it in. You're just going to try to go straight back. And what it's going to do is lengthen the tissues in the back of your neck, but at the same time, you're strengthening them. So you're trying to strengthen that upright posture. And then that pulling will also cause stress on the bone, which hopefully will help build bone density in that area. The next one is a shoulder press. So again, you can do this lying down, but you can do it standing too. And that's just to try to help, as we pull our shoulders back, it's to open up the front of our chest. Again, we do everything in front of us. We tend to just kind of go with gravity and curl. But that will help stretch and open and help with our breathing. But then if you're activating those muscles, then you're strengthening that area, which will help keep us in that upright posture. And then we have what's called the leg lengthener. So I always tell people, visualize yourself on the beach, and you're going to press your leg straight down into the sand, and you're going to make that groove. So you're just going to basically press the whole entire leg straight down. So if you think about also as we age, we tend to start losing our flexibility. So our knee might not go as straight as it could possibly go. So that'll affect our walking, and the wear and tear that's occurring on our joint. Well, this will help open up the knee a little bit, make it straighter. It'll also help strengthen like our buttocks and our hamstring to help pull you back into that good upright position. And then that we have a leg lengthener. So I think I actually took this pictures from somebody, but it's actually flip-flop. So the bottom is a lengthener where you're trying to press your foot like you're trying to reach across the room. So it kind of stretches and opens up the hip a little bit.
Sounds great.
Yeah. So these are just very gentle exercises. Anybody can do them. You can be going through spine pain at this time, and we could get you in a position of comfort and do these exercises. You could be at WSRH and just have spine surgery, and you can get started with these exercises, again, just to kind of maintain those muscles and to work on your posture.
I just have a quick question. What do you think about inversion tables?
I think that they can work for certain people, so that they definitely help decompress and unload the forces of the spine. But if you have issues elsewhere, maybe at your hips and your knees, if that's like, so basically it always goes to like the area of weakness. If like you have a lot of laxity in your knee and then now you're inversion, you're upside down on that table, and there's traction on your knee. The traction will affect that weak spot more than the spot that you might actually need that attention to.
That makes sense.
So like I said, some people, like I don't think I would be able to tolerate it because I don't like that feeling of blood rushing to my head. But for some people, I think it would work very well for.
But you just need to be careful about being aware of weak
Yeah,
spots.
weak spots. Yeah. It's not for everybody. And then the other challenge is getting on and off of those. So you can, I've heard people get into the position and then they can't get themselves out of it. That can be a challenge. Okay, so this series of exercises, again, are for anybody that could be, somebody that has experiencing back pain or somebody that's very healthy, somebody that's just had surgery. They're all done lying on your back. And you're probably thinking, well, how in the heck is that going to be strengthening my back? These figures are using TheraBand. So as the lady on the top left is pulling on this TheraBand, she's actually activating the muscles in the upper back. So if you remember your body responds best to stress, and we want to strengthen those erector spinae, or the muscles that go straight up and down the back, and to kind of help pull us into that upright position. So there's one that you're taking that TheraBand and you're pulling it apart and lifting it over your head. So you can imagine that this is stretching through your shoulders and your chest and bringing it back down. So I always, people tell me, how many reps should I do? This, it even says 3 to 8 times. Just do it a few times and just really take it slow and take a deep breath in and then out as you do it. Another one you can do is just pulling that band across your chest and bringing your arms as far out to the side as possible and then bringing them back in. Again, you want to do these exercises. There's different color bands, and I was like, what color should I use? Well, every manufacturer has a different color, so I can't tell you that, but you can experiment for yourself. So you want to be able to do it in a controlled way. If it's like flinging you back to the center,
it's
probably too much, right? Yeah, you don't, because you don't want to hurt yourself, but you want to feel like you're in control of that motion the whole time, and you don't want to do it too fast because you're using momentum. So you just want to keep that band nice and controlled. The other one is called the sash. I call it the Miss America. For the women, or for the men, you're pulling the sword out of its sheath. So you're gonna bring it up at an angle and then back down. Or this could be like the John Travolta, like the Staying Alive.
Yeah, Staying Alive.
Yeah, there you go.
Got it.
Okay. And then there's one, the second picture down. Let's see. Right here, it's a little bit awkward, but you're pulling that band across your body, kind of like a slightly different, one-handed. And then it gives you another option. So then we have the bow and arrow. So you're going to start with both of your arms up toward the ceiling, and then you're going to pull that band apart. So you're bringing that elbow straight down to the table. Don't let go of it, and then bring it back up. And then the bottom right is really good for the rotator cuff, not the cup, the rotator cuff. You're going to keep your elbows by your side, and you're going to pull that band apart. And none of us can go all the way out to the side. I think that picture looks like the hands touch the floor. It will not happen unless you have really loosey-goosey shoulders, and that could be another problem. But you're just going to pull them out and then bring it back in. These, like I said, all of these exercises really focus on strengthening the back. They help promote good upright posture, and that's what we want.
So great.
Yeah. And then people always ask me, well, what else do I do? What else? So I'm like, good, you're on the exercise wagon. All right. So there's some other options. Not everybody likes to do the same thing. So we try to promote different activities. So I know I said something about the pull earlier. That would be more for like the water walking. But if you're swimming, like you're doing laps, that's working a lot of those muscles that we were talking about, and really elongates that posture. So if you're doing like a freestyle or a backstroke, and you're getting in the cardiovascular activity, it's a little bit different than just walking in the pool. So you can do some controlled dancing, nothing too wild. Okay. There's some classes that are like safe yoga. There's a lot of yoga positions that do a lot of flexion in the spine. So if you do have a diagnosis of osteoporosis, you don't want to do a lot of repetitive forward bending. It's actually contraindicated. It's just kind of perpetuating that advancement of those fractures, and you don't want that. So we want to try to keep our spine as pretend you're Barbie. Remember Barbie? She's very plastic, and well, the old Barbies. I think the newer ones do more things, but she doesn't move except for her arms and legs kind of pivot. She's always thinking about her spine. So that's how we should be thinking about ourselves. Who knew? Modern day Barbies. Tai Chi, because Tai Chi really focuses on balance and posture and breathing. Lifting weights, so there's certain exercises that we should do and certain exercises we shouldn't. So just because it's like lifting a weight doesn't mean it's good for us. So with like deadlifts or a lot of the machines at the athletic club can be detrimental. So it might be good to have like a physical therapist work with you on specific exercises that each individual may need. Like what I might need is completely different than what you might need. And that's what we could do during an evaluation assessment, is to see, which areas are you strong, what needs to be strengthened. So for a lot of people, it's strengthening the core first, which is your stomach and your back working together as a unit. And that does take training, believe it or not. Like I help my daughters who, my daughter tore her ACL, she hurt her knee. And a lot of it, I think, was her core was so unbalanced. So we're just trying to teach her, okay, how do you keep your stomach muscles in when you're doing these exercises and maintaining posture? And she was 18 years old and she couldn't even do these exercises, but she had to really think about it and learn how to control her body and how to use it correctly. So that it takes a professional. And she don't want to admit to mom,
But I think a lot of women who may have had a pregnancy or two or more, and I just think there's a lot of reasons why our core is weak.
Absolutely. And anytime you've had a back injury, our back muscles tend to shut down a little bit, and we just don't use our body correctly after that. You have to re-educate them. So again, that's where like the professional training can really help.
So if someone has an injury and is referred to physical therapy, then that is very beneficial.
Yeah.
But for everyone else, what resources are available?
Yep. So there are, there's lots of different exercises that you can find online and books that are great. But really, like, I think if you can just get out and go walking, like being outside is healing enough as it is, getting that fresh air, but you're getting that pounding over and over again. I don't know if you've heard of pole walking. So it's like this. Yes, right here. So that is amazing because it really does promote upright posture. You cannot walk with the poles and be slumped over. It's like physically impossible. And then for people that might need a little assistance with balance, it kind of looks cool. It's not like you're walking with a cane or something, but it's promoting that upright posture. And then
I didn't know. I thought that was as an aid
right,
for someone who needed that extra support, but it actually is helping you maintain.
Yeah, it can help with balance a little bit. It absolutely helps with your upright posture, but it's weight bearing through your arms. So now you're getting bone density through your arms.
I need to get those.
And it's a little bit more aerobically challenged for your heart because now you're getting your arms involved, but you won't feel that exertion in the same way. Yeah, so everyone's going to run out and get the poles from Dick's Sporting Goods store. I don't know. And you can go and watch videos on YouTube. It'll show you like how to adjust your poles. But it's fun and you don't really realize that you're working that hard.
Yeah, I love it.
Yeah. They have weighted vests. I don't know if you've ever seen people walk around with them. You kind of see like military people do it. They'll put it's a vest that they strap on and then they can slide these different size weights in them. But that force, it's pushing you to the ground. It's going to make your bones work a little bit harder every time you.
Wow.
Yeah.
Very creative.
Elastic bands, all those good things.
All right. So how much do we need to exercise?
every day. So weight bearing, we usually say like 30 minutes on most days of the week. So that is almost every day. And walking, I think we just need to get more walking in too.
Yeah.
It's easy. It's easier now this time of the year when the weather is nice, but when it's raining, like it's been on the weekends, you just don't get out. And COVID has really kind of kept us indoors. A lot of people used to go to the mall and walk, or even here at Apple Hill, we had the Apple Hill walkers. But just trying to incorporate more steps, park a little bit further, walk around Walmart, the whole entire periphery when you go in there. There's a lot of steps there. Strengthening, you can do 2 to 3 times a week. You do need a day in between to kind of help the muscles return. And then working on your balance, your posture, and some functional activity modification every day, all the time, as much as you think about it. The more you do it, you won't have to think about it as much. But if you're thinking about it all the time, then you're probably self-correcting. So we're all going to have nice, tall posture. Yeah.
All right. And you have some references, and any listeners at home that have any questions, now is a great time to ask. So, and you can just submit those by typing your question into the Q&A area on your screen. So tell me what you have here.
So the National Osteoporosis Foundation, if you search them, they give you all sorts of information from nutrition to things to avoid, they might even give you a link to the FRAX, which I don't know if you've ever heard of it. It's basically, it'll ask you a series of questions to see how much of a risk you are for a fracture. If you have had a scan, it will give you a little bit more accurate of an assessment. I went on today and basically I have very low risk right now because I have had it says, have you had a fracture? Yes, but it was trauma. It wasn't like I tripped and fell or, I was playing field hockey. So it was a little bit different. Yeah. But, they give you lots of great information. And then I went to Sarah Meek's course and she has a lot of great books out, which I took a lot of my information and pictures from. So these I'm pretty sure now on Amazon. Okay. So there are small books like Walk Tall, Stand Tall. She's devoted the majority, she's a physical therapist and is devoted the majority of her career to treating people with osteoporosis and really impacting them, educating them, and working on prevention.
That's awesome.
Yeah.
All right, so I'm going to go out and buy some poles and
some TheraBand.
and Sarah Meeks's books.
Yep.
And a listener is asking, when will this video be available online? Sue, if there's no other questions, we can wrap it up so everyone can get outside and maybe walk around a little. And Sue, you can address the question about when the video will be uploaded and available.
I am happy to. I have to say, you didn't get any questions because this was so comprehensive.
This really was.
Oh, wait, we do have,
okay.
One did just pop up.
Okay. I have chronic neck issues and pain, and people have told me I should try physical therapy. Can someone just go get PT, or do you need a referral?
So a lot of times it does depend on your health insurance. You can go directly to a physical therapist, but I would really probably say go to your PCP first, just to kind of make sure that everything, kind of check everything out with them to see. They might order some further testing or have some other recommendations prior to going to physical therapy. But therapy is a great place to start. It's very conservative, especially if you've had chronic neck and back pain or neck. There's so many things that we can do for you. You don't need to live feeling uncomfortable all the time.
Yeah. And I think a lot of people, when they think of physical therapy, they think that it's limited to patients who are in rehab or have had a major injury. But there are so many other applications for physical therapy. We had a pelvic floor physical therapist
Absolutely.
who was talking about all of the, all the ways that she can be helpful.
Yeah.
Thank you so much. This was so helpful.
You're
I learned a
welcome.
lot.
Good. I had a really great time. Thank you for inviting me to be with you.
Good night, everyone.